Hello and good evening. This is Dr. Anirban Shukul, the director of Shukul Institute of Homeopathic Research in Kolkata, India. My background is I'm postgraduated in zoology, PhD in neuropharmacology, and thereafter I studied homeopathy. I practiced homeopathy for more than 25 years. I have clinics not only in India but in abroad. Today I'll discuss the most suffered in all types of cancer is the lung cancer and its homeopathic management. Lung cancer is a kind of cancer that starts as a growth of cells in the lungs. The lungs are the two spongy organs that controls our breathing. Lung cancer is the leading cause of all types of cancers, death. People who smoke have the greatest risk of affected with the lung cancer. The risk of lung cancer increases with the number of years they smoke and the number of cigarettes they smoke. Quitting smoking, even after smoking for many years, lowers the chances of developing lung cancer. People, those who have never smoked in their life, can be affected with lung cancer. Lung cancer typically does not cause any symptoms early on. Symptoms of lung cancer starts when the disease is being advanced. Symptoms are a new cough that does not go away, coughing up blood with sputum. The symptoms like wheezing, shortness of breath, chest pain. So these are the common symptoms of all types of lung cancer. Signs and symptoms happen when the lung cancer is spread to the other parts of the body. These symptoms are associated with body pain, headache, losing body weight without trying, loss of appetite, swelling of face and neck, and etc. Lung cancer happens when the cells in the lungs develop changes in their DNA. A cell's DNA holds the instruction what to do, like the rate of multiplication at a set rate, and also to die a cell at a set time. In cancer cells, the DNA behaves differently, gives different instructions. As a result, they multiply or proliferate very quickly. Cancer cells might form a mass which is called tumor. This tumor in the later on invade and destroy the healthy body tissue. In time, the cancer cells can break and spread to the other parts of the body, which is called metastasis. Now we have to understand that how tobacco smoking can cause lung cancer. Now researchers believe that smoking in the long term can damage the lining of the cells in the lungs. Smoking is full of carcinogens or the cancer substances, cancer causing substances. When you inhale cigarette smoke, these carcinogens almost immediately causing changes in the lung tissue. Initially, your body may be able to repair this damage, but later on, after prolonged smoking, this damage can be permanent and it cannot be reversed. Over time, the damage causes cells to change and eventually cancer may develop. Let me discuss the different types of lung cancers. Now, the types of lung cancers is largely divided into two major groups. And this division or these different types of lung cancer, two major types of lung cancer, is based to differentiate the cell under a microscope, how they look alike. So based on the appearance of the cells under a microscope, these types are two kinds. The first kind is the small cell lung cancer. Now this small cell lung cancer is caused or is present in those types or those people who have smoked heavily for years after years. Now this is a very less common type. This is not very frequently we have seen. The other type of the lung cancer is non-small cell lung cancer. Now this type is having is a category of lung cancer, having several kinds of lung cancer under this category. It is a category that includes several types of lung cancers like squamous cell carcinoma, adenocarcinoma, and large cell carcinoma. Now discuss the risk factors of lung cancer. It's largely the smoking, the secondhand smoking or passive smoking, the cancer causing substances, family history of lung cancer or any types of cancer, exposure to radon gas, and previous radiation therapy. The complications may arise like the shortness of breath, fluid in the lungs, chest pain, and the cancer that spreads to other parts of the body. So what can be the prevention for the lung cancer? The first and foremost always comes that don't smoke or stop smoking, or avoid secondhand smoking. Avoid with any kind of cancer causing agents, especially at your workplace. Eat a diet full of vegetables, plenty of water, drink plenty of water, and do at least a little bit of exercise and walking every day. Now comes to the homeopathic management. There are classical homeopathy, what I practice, and I have so many lung cancer patients that are doing quite well. In addition, I have personally got trained mistletoe for cancer. There are advanced training that I got from Germany, and I apply to all my cancer, all types of cancer patients. Particularly in the field of lung cancer, I have got tremendous results after using both homeopathy medicines and mistletoe together. So the quality of life is largely being extremely well as long as this mistletoe therapy is being administered or introduced into your cancer patients. So be healthy always. I hope this video has come to your benefit and stop smoking. Thank you very much.